Scientists in the United Kingdom are worried the vaccines being rolled out may not offer protection from the South Africa COVID-19 variant. Now, variants have been detected in the UK and South Africa, but experts warn the South Africa variant has a number of additional mutations, including alterations to key parts of the virus known as spike proteins that might make them less susceptible to the vaccines. Scientists behind two of the vaccines currently being used in the UK say they are testing the vaccines against the new variants and could make any changes quickly. Let's bring in Lawrence Young. He is a virologist and professor of molecular oncology at the Warwick Medical School. Doctor, thank you so much for your time today. I was urged by one of your colleagues, you got to talk to a virologist about what's going down with respect to these vaccines. So let's do it. What is your thought with respect to Britain now really trying to protect its citizenry from this new variant, or should I say variants, plural?
Yes, well, we're currently in the grip of the UK variant, and it's quite clear that that variant, which has arisen in London and the southeast, is now fueling the current rise we have, the very dramatic rise we have in infections. Hence, we're just entering another national lockdown as a consequence. So these variants are occurring all the time. It's just that one of them has popped up in the southeast of London, which is more infectious. And there is this South African variant, which is even more worrying, actually.
So tie this back, if you can, Doctor, to the vaccines that are currently out. And I understand in the UK, you're focusing on rolling out the AstraZeneca vaccine. How confident are you with respect to that vaccine's capabilities to tackle these various variants?
So we can look at the genetics of the virus. An important part of surveillance, and something I have to say we've been doing quite well in the UK, is mapping the changes in the virus. And we know that the current variant that is responsible for transmission in the United Kingdom has a couple of changes in that spike protein gene that you just mentioned. That's the focus for the vaccines. But those changes are minimal. And our belief is that the current vaccines, both the AstraZeneca Oxford vaccine and the Pfizer-BioNTech RNA vaccine, will both be fairly efficient, actually, at blocking that virus. So that's being tested at the moment. We're quite confident about that. We're not so confident about this new variant from South Africa. Okay, so I understand you're also quite nimble, or these vaccines perhaps are quite nimble in terms of you can tweak them, is that right, to address these new variants that are popping up. But let's get to the lockdown. Give me a sense, what is the feeling on the street in the UK now that you are officially in lockdown again? Well, people are just exhausted by the whole thing. I think they're very confused about mixed messages, even in the last week or so, from our government. I know it's not easy for any government under these situations, but I think people are just exhausted. There's a general sense of, I guess, a lack of confidence in the way things are going, and everybody's hanging on for the vaccine. The only light at the end of the tunnel, it seems, for people is the vaccine. Although I keep saying that whatever happens with any variant, as long as we obey the social distancing and the other restrictions, we can stop transmission. But people are really, I think, quite flat and rather depressed about the whole thing, actually. And that's, I know you're a virologist and you tackle the vaccines, and now you're looking at various mutations and variants, but that depression, that's serious business, right? That's something we really have to keep an eye on for our friends, family, our colleagues, just the isolation and the impact that that's having on scores and scores of people as various communities are in lockdown. Yeah, absolutely. And the mental health issues are really quite frightening. And this is also impacting, kids at school. We've shut down schools again now, and this has a very significant effect, not only on obviously on the education of school kids, but also on their mental health and well-being. So this has dragged on for a long time now, and it's a very, very significant issue. And it's hard to encourage people when folks have think, well, we've been through this before. Why didn't we get this sorted in the last lockdown? Absolutely. A lot of big questions there, and hopefully those answers come very, very soon. In the meantime, stay safe, sir, and thank you for your time. Thank you. That is Lawrence Young, virologist and professor of molecular oncology at the Warwick Medical School.